I'm Marla with Nine Health, and thank you for joining us on our show, Health Happens, and we do
You're
this
welcome.
every Tuesday at 11. And we are here to explore really how health happens. We know it's happening every moment for everyone. It's happening maybe a little bit differently, and we're today going to talk about how your heritage can maybe affect some of your health. So we're joined by Dr. Frank from Denver Health. Thank you so much for coming.
Thank you for having me.
Yes, we're lucky.
It's going to be fun.
It is going to be fun. We're going to have questions from the audience. If you guys have any questions about your health and how your heritage might be affecting your health, or any other questions you have, please jump in and ask us the questions. We'll try and give you answers. If we can't answer them right now today, we'll find an answer and put it in the feed. How about that?
That
Sound
sounds
like a deal?
fantastic. Yep.
Well, so really great. It's Hispanic Heritage Month, and so we wanted to talk about a little about our Latino and Hispanic cultures. And I know myself, I love the tortillas and the enchiladas and the things like that. And
Who doesn't?
yeah, who doesn't, right?
Yeah.
But how does our heritage really affect our health?
So with our heritage, we have like different things to consider. One is our environmental culture, and one is our like genetics.
Right. I'm gonna grab my phone and see if anyone's asking us questions.
So
Keep going.
from like our environment and culture, basically is what we have learned during like when we were growing up, and what we learned to eat and what we like to eat based on our culture. So in the United States, we have at least 1 out of 6 people are Hispanic.
Right.
And sadly, we have a very, very high incidence of obesity. We went in 1999, we have like 20% of adults, Hispanic people were obese, and now it's like 42%.
Wow.
So, and sadly that will probably has to do with diet, lack of exercise, getting used to the American way, and
Yes.
and that will lead to other problems like cardiovascular disease, diabetes, which is very, very high among Hispanic population.
Yes.
But we can get deep in any of those topics that you would want.
Yeah, well, it's a big field, right? So all of us as Americans that live here, there's a lot. Obesity is a huge problem for everyone.
It is.
Yeah, and so as a Hispanic, right, we have even higher incidence of obesity. It sounds like.
We have higher than white non-Hispanic. We
Right.
don't. We are like similar levels with Alaskan and Indian American and African American people. We are like there fighting for the first place, but we're still a little higher
I
than
don't
the
think
white
it's a good first
non-Hispanic.
place to have.
I agree with you, but let's look at the positive.
Okay. So
The negatives that we have a lot of obesity, and that leads to a lot of health problems. The positives, like, oh, we make it in the first place.
okay, sounds kind of like the booby prize, but all right.
Yes, it is.
So this problem with obesity, and you said some of it's environmental and some of it has to do with just our genetics. Tell us a little bit about how our genetics play into how our health
So
expresses.
in our genetics like explains a lot of different things, like our predisposition to diabetes, sometimes to hypertension, to certain cancers. However, our Hispanic population here is very heterogeneous. So all the geneticists that have been trying to link, okay, people have diabetes because it's this gene that Hispanics have that other people don't have, they were not able to find it. In particular, it's because we have a lot of like mixed races within the Hispanic population. So even though we know that diabetes type 2 is genetically predisposed for any race, there is a factor, but also the environmental and the social and the culture have a more,
Right.
like a bigger influence than our genes.
Right. So you say genes do play a part, but
It's not all.
it's not all.
No.
The other part is environmental.
And the genes we cannot change.
The
but
genes you can't change.
we cannot
so you got
change.
the genes you got, and that's how it's going to
Yeah.
go for us.
And the good news is there's a lot of the other things that we talk about, environmental and culture. We can do something about it, and we can do prevention, and that's why, as a community, maybe we can help each other to make that better.
Right. So when you talk about the genes that we have, and that's our heredity, and so we might be predisposed to getting, say, diabetes, for example, as a Hispanic. What is it that you could say that we could do about that?
With diabetes,
Yeah,
in
so,
general,
You know, today here we are. We're joined
Yeah.
by Dr. Frank. Thanks if you're just joining us. And we're talking about how our heredity can affect our health. And one of the things we know is that Hispanics have a higher incidence of some diseases like diabetes. But you're telling me that that's only part of the story. your environment and your culture and the things you do can make a big difference.
Yeah, and as again, but like being an individual is not just our genes. There's a lot of things that influence who we are, and that's what makes us unique. As a community, the culture plays a big part because of our diet.
Yes.
And yes, everybody loves tortillas.
Yeah, I do.
So it's like, well, do we need to stop eating tortillas? Not necessarily. It's
Okay.
maybe most about like
you can still eat tortillas.
portion control and add a lot more like fresh vegetables and fresh fruits to our diet. Try to decrease, don't eat 10 tortillas a day. Eat maybe some less.
So 10 tortillas will be bad then.
It's not about the number.
But portion control is important.
Portion control is important, and also keeping a healthy weight.
Yeah.
So if we have a healthy weight, probably you can eat more tortillas
Right.
because that will, in a way, counteract what's happening with our diet.
Okay.
So it's not all diet. We need to put everything into context, get a healthy habits overall.
Okay, good. So healthy habits. Tell us a little bit about like what is maybe the 3 main points that you would say about a healthy diet, because we all, like you said, we're all going to want to eat tortillas, but if we do that, then what?
So healthy diet includes overall, particularly thinking of what is the typical Hispanic diet, try to eat low salt. I
Low
know,
salt.
hard. But after you get used to it, you can barely notice it's not there. So maybe the first month you're going to hate it. But after that, it gets
You'll
better.
get used to it.
Yeah, you get used to it. Low fat, if possible. So we eat a lot of fried stuff. So can we just decrease the fried and maybe bake some things?
So decrease the fried foods.
And then increase the amount of fresh fruit and vegetables. Those are like the big 3 pillars of having a healthier diet.
Yeah, that doesn't sound that hard.
It's not that hard,
So I've got my phone here.
particularly
ready.
from here when we're not cooking,
Exactly. When we're not,
when we're not doing grocery shopping.
That's right.
Yeah.
That's right. So if you have questions for Dr. Frank, and we're talking about how your hereditary really affects your health, and how environmental factors affect your health, maybe even more, right?
Yeah.
Yeah. Yeah. So if you have questions about that, and you want to know how to be healthier, and you want to know what your heritage maybe put you at risk for, go ahead and ask us questions. I've got my phone here. We've got Edward already. Thanks, Edward. I do. He says, I love tortillas.
Who doesn't?
We
We agree.
tortillas. And it's not that you can't eat them, right?
Yeah, it's just portion control.
Yeah.
And there's a difference whether if you already have diabetes, probably you need to try to minimize the tortillas as much as possible. If you don't and you're trying to prevent, maybe you have a longer path to getting used to decreasing the number of tortillas you're going to eat in a day. As I said, you don't need to go to 0, at least not from starters.
Yeah. So you talked a little bit about diabetes. Are there other health conditions that Hispanics are more predisposed to?
So there's a couple of, so the highest causes of death among Hispanics are, the first one is cancer, and the second is cardiovascular. So cardiovascular is the biggest cause of death among all, like the overall.
Right.
But
Everyone.
for Hispanics, we invert and go to cancer first, and second is cardiovascular.
Okay.
Third one is unintentional or intentional injuries.
Okay.
So motor vehicle crash, homicide, fall from heights, work-related injuries.
Right.
So there's a lot of prevention that can be done in that area.
Yeah, safety, yeah.
As same as the cardiovascular one.
Right.
When we talk about cancer, are we more predisposed than other ethnic groups? Absolutely not.
Okay.
The problem is that probably they're caught later. And that is one of the big problems.
So
and
it's not that there's more cancer or in Hispanics. Or
It's actually
Latinos.
less.
There's actually less. It's just caught later.
but causes it's our main cause of death.
Gosh.
Also, because our cardiovascular cause of death, even though we get a lot of risk factors, people don't die from it that much.
Okay.
But the cancer one, there's a lot of cancers that are preventable, and that will take me to other. So among the 10 bigger causes of death among Hispanics, in the top 10 we have liver disease. Of course, causes related to diabetes, that will be like number 5 and 6 will be liver disease and diabetes.
Okay.
And between 1, 2, 3, so we had cancer, cardiovascular disease, unintentional injuries, and then we're going to go to like diabetes and liver disease, there's a lot of things that we can do to prevent it. So one of the good
That's
things
important.
about the list is that there are things that we can do about it.
That's important. There are things on the list, and you can actually really prevent these things.
Yeah.
One of the things that we do at Nine Health Fair is we offer preventative screenings. So
Yeah.
for diabetes and for liver and things like that. So we have health fairs going on right now. There's one at Lamar Street Center this Saturday from 8 to 12. So if you are interested in getting out there and getting some preventative screenings, you can check that one out. There's also other ones going on all throughout the fall. So ninehealthfair.org is the place to find those.
That is great.
Yes, because it sounds like they're preventable.
There's a lot of them. So we know like lung cancer is the main cause of death among Hispanic males. And we all know that smoking actually will put us at risk for developing lung cancer. So can we try to have people and our neighbors and our family just let's quit smoking? And if you have two people in the house, let's all quit smoking at the same time so we can help each other.
Right.
And
so smoking is probably one of the first
smoking
things
is one of the main things that we
quit
want.
That, right?
We do want to quit that. We don't because we don't.
We don't.
We don't smoke, but you would want to quit that.
If you do smoke, that's probably one of the things that you could do.
Yeah.
Very first thing.
And there's a lot of things like free resources to actually quit smoking. You can call the quit line. They can send you like free nicotine patches. You can talk to your primary care physician. A lot of like health systems are now being evaluated on how good they are in reducing smoking within their community, the communities that they serve. So I think that any place that you go, whether it's Denver Health or any other community center or health center that you go to, they're going to help you out with with quitting smoking. So that's a big thing.
Yeah. So that would be one thing to do. Eating a healthy diet. Would
Eating
be
a healthy
another thing
diet.
to do.
Reducing alcohol.
Reducing alcohol.
Again, there's no more drinking within Hispanics than among other people, but there's more people dying from liver disease, so it affects them a little more than other people.
Gotcha. Do we know why that is at all?
Probably a combination of factors, so could be some genetic predisposition, but also the high rates of obesity predispose people to fatty liver.
Okay.
And fatty liver just damages the liver, so the continuous damage for the alcohol will make it worse and cause cirrhosis. Also, hepatitis C is somewhat higher in the non-U.S. born Latinos.
Got it. Yeah. So the CDC, I know, recommends that all baby boomers, whether you're Hispanic or whatever, get a screening for hepatitis C because I guess there wasn't screening, right, for Hep C?
So a lot of people, like within the baby boomers, they were like the new birth control, so they were not wearing condoms. So one thing to prevent hepatitis C.
Didn't know we were talking about condoms today.
It's like, no, we were not, but we are. We're talking about prevention and how to make your health better.
That's right.
So some ways to prevent hepatitis C is wearing condoms, particularly when you are having intercourse with people that you don't know very well and you don't know the risk factors. Hopefully, I can say don't do IV drugs, but if you're going to do not share needles. That's another way to prevent it. Sometimes for those people who are doing IV drugs, it's hard to quit. There's a lot of resources to help people quit. But in the meantime, just don't share needles. And all the other ways that people got infected, the baby boomers were controlled now. So, like, blood transfusion is checked. A lot of people acquired during the Vietnam War.
Oh, okay.
So, but now we're a lot better than that. So there's like two big things to do to prevent
Well,
it.
you heard it here. This is Dr. Frank, and she's going to tell you about how to prevent some of these diseases.
Yes.
So, you know what? One of the things I want to touch on before we kind of wrap up is that, you are a successful doctor at Denver Health, and we so appreciate you joining us. You are a role model, really, to all of us in our Latino community. Tell us a little bit about how it's been coming up and being Latino and Latina, and how it's been for you.
That is a hard question only because I never felt discriminated. So
That's
I think
great.
I work in a great place. I think that I work at the University of Colorado and Denver Health, and I never felt like people were treating me differently.
That's great.
So I think that if you actually work hard, most people in great places, they're not going to make a difference of whether you're Latino, you're white, you're African American, or you're any other race. So it's like I think that the big thing is work hard.
Work hard.
And yes, sometimes there are people who will discriminate, but at least in the places where I have been, I gotta say that I never felt it. So
That's really great. And, you know, I think a lot of us now are having more opportunities than ever before,
Yes.
which is really great.
Yeah.
What would your advice be to anybody out there kind of watching and listening? And
You can be anything you want to be. You just need to work at it, and
That's
you will
great
be able to do
advice.
it. So it's like it just takes commitment, and support. Sometimes if you have family members and friends that will support is great. But if you want to do something, you work hard at it, you're gonna get there.
Yeah, that's great advice. Thank you so much for
You're very
telling us
welcome.
that. And you know, we have a lot of health fairs that are coming up this fall every weekend. So if you are interested in preventing any kind of these diseases and finding out about your health, you can go to a health fair near you. Just go to 9healthfair.org and sign yourself up. So we're going to go ahead and sign off, but if you have questions, go ahead and send them in. Thanks.
Bye.